I'm Dr. Rita McGuire. I didn't even introduce myself. I'm the Chief Medical Officer for Wakanna. I'm also one of the co-founders of this amazing company. And each and every Wednesday, we have a very, very exciting topic. Last month, the whole month of June, what did we do? We talked about issues that affect men. Why? Because it was Father's Day month. What's happening in July, we're going to dedicate the entire month of July to the Clinical Endocannabinoid Deficiency. This is really, really important to understand. Why? Because it makes you really appreciate why you need CBD. Why do you need to supplement your body with CBD? And it's because of this endocannabinoid deficiency that we're going to be spending the whole month on. And I'm telling you, I am so excited. Well, I have a surprise for all of you, but I'll let it out of the cat. What is it? The cat out of the hat? Something, the cat out of the box. You know what I mean. It's been a long day and I'm on call as well. But I've got a surprise for each and every one of you as it relates to this particular topic. So I represent the pillar of health, which means that I am responsible for really educating our business partners, educating their prospective prospects, their customers on how our products work in the body. So we're going to start by first talking about the endocannabinoid system. It's a really long word, but this system was actually discovered when I was in medical school. I attended Wayne State School of Medicine in Detroit, Michigan. In the early 1990s, this system was discovered. And it was discovered because a gentleman by the name of Raphael Mechoulam, who is a scientist, an Israeli scientist, was trying to figure out how does THC make people high. He was really looking at marijuana. And he came upon this system that every single person has in their body. It's very much like all of the other systems that we learn in grammar school and high school, the musculoskeletal system, the endocrine system, the nervous system. All of those systems come together, but this particular system, the endocannabinoid system, is the most vital system that regulates a lot of things that we have to respond to, a lot of things that we have to regulate, things like memory, mood, appetite, fertility, pregnancy, pre and postnatal development, just overall balance in our body. This particular system is responsible for. And so that's why it's deemed the most vital regulatory system in our body, because it does so much. And so what it has is what we're going to talk about. And then we're going to talk about how, when it does not work properly, how we become a patient that is having symptoms of a clinical endocannabinoid deficiency. So this system consists of receptors. It consists of cannabinoids. It consists of enzymes, and we're going to break down each and every part. So what is a cannabinoid? Many of you know what cannabinoids are. They're a class of chemical compounds. They're actually compounds that the plant can make, the cannabis plant can make. Those two most common compounds are THC, or tetrahydrocannabinol, and that's the part of the plant that gives us the high, the euphoria, the paranoia, right? When we consume THC, we become high. And then there's another part of the plant that's called CBD, or cannabidiol. This is absolutely non-intoxicating. So the only thing that you feel when you take CBD is calm. You feel relaxed, but you don't feel high. There's over 120 plus compounds that they have now discovered that the cannabis plant makes. But guess what? Guess what? Our body makes cannabinoids too. And those are called endogenous cannabinoids or endocannabinoids. So it's being produced within our body. So two of the most common endogenous cannabinoids that are produced naturally by our body, one is anandamide and the other one is 2-AG. So let's look at anandamide. Anandamide is a fatty acid neurotransmitter. And you'll hear that word a lot tonight. But just think of a neurotransmitter like a messenger, right? It's responsible for sending a message to different parts of the body that could be out of balance. It's also an essential omega-6 fatty acid. In fact, ananda comes from the Sanskrit word, and it means bliss. It means joy. It means delight. So when you're looking at an analogous part of the plant, anandamide is very much like THC, right? When you take THC, you have that joy, that bliss, that high, that just wonderful feeling. And then we have 2-AG. Now think of 2-AG like CBD. It would be analogous to the plant cannabinoid CBD. So 2-AG is it's the most abundant endocannabinoid that our body makes. It is responsible for much more than anandamide. See, anandamide just makes us feel happy. But 2-AG is important in appetite, in our immune system, in regulating pain management, in our circulatory system, so that's your blood pressure, your pulse, in suppressing seizures, and it is most abundant in breast milk. So a lot of people think it's the anandamide, but it's really the 2-AG that is most abundant in breast milk, which means that if you know a mom that's breastfeeding her baby, you can now educate her in saying that you are giving your baby compounds very much like the cannabis plant. They're called cannabinoids that our body produces. So 2-AG is the most abundant one that our body makes. And then we have the receptors. These receptors are found throughout our entire body, right? And these receptors are looking for these little messengers. Remember, I used the word neurotransmitters? So the receptors are looking for anandamide. They're looking for 2-AG so that they can bind and send a message to the brain and say, hey, Cora needs to go to sleep. Or Cora is really anxious right now. Or Cora is really depressed right now. You need to release those hormones in the brain so that Cora doesn't feel like that. So these receptors are all throughout your body looking for the endocannabinoids, the anandamides, the 2-AGs to put the body in balance. So they are responsible for sending that message when the body is out of balance. So that brings us now to the clinical endocannabinoid deficiency. And it was discovered in 2003 by Dr. Ethan Russo, who I spoke on the same stage with last year in Portland, Oregon. And guess what, folks? He is coming to Wakanna. Yes, he is going to be on my Zoom webinar on the end of the month. This gentleman is the physician who discovered the clinical endocannabinoid deficiency. So excited. Really great guy. And the way that he discovered this deficiency is he was looking at depression. And he was looking at the fact that depression is known to be brought on by a deficiency in serotonin. And what they did is that they took a group of folks that were depressed and they did a spinal tap on them. They took some fluid around their spinal cord. And what they noticed is when they were trying to measure some endocannabinoids like anandamide and 2-AG, they found that folks who are depressed had very, very low levels of anandamide. And so he started doing more research on different disorders and found in every single case that when he tested these folks who had migraines or fibromyalgia, irritable bowel syndrome, or arthritis, depression, anxiety, they all had low levels of endocannabinoids. And so when you give a person an increase in that activity, or you upregulate, or you just give them some CBD, you see a response in several disease entities. So what causes the clinical endocannabinoid deficiency? Again, the theory is that the body just doesn't produce enough endocannabinoids. And if those endocannabinoids are deficient and those receptors are left without a message being sent, that's when disease occurs. That's when the body becomes out of balance. So it's important that you've got cannabinoids around, right? You got milk, you got cannabinoids. So here are some of the symptoms of clinical endocannabinoid. And you may notice that you may have one of these symptoms if you're on the webinar, or maybe you know someone that has these symptoms. Some of the symptoms include a person that struggles with insomnia to the point that they have to start taking medications like Restorol or Ambien. Another symptom is anxiety. Hey, we've all got anxiety at some point or another. Conditions associated with heightened inflammation throughout your body, like arthritis, obesity, diabetes, lupus, fibromyalgia. Anger management issues, oh my goodness, I'm not giving any names. Depression, bone loss, chronic pain, dementia-like symptoms, and family history of cancer. Now, these are just a few of the symptoms that will alert you that you suffer from clinical endocannabinoid deficiency. There are also many diseases that we're going to talk about throughout this entire month that make up the clinical endocannabinoid deficiency. These have been studied, these have research data, and they include migraines. How many people do you know that has migraines? Fibromyalgia, idiopathic bowel syndrome or irritable bowel syndrome, causalgia, allodynia, brachial plexopathy, phantom limb pain. That is pain that is unbearable, excruciating pain when someone has undergone a surgery like a rotator cuff surgery, or maybe a meniscus repair surgery, or maybe a fractured femur that has now been repaired, or a hip replacement. Any of those sort of surgeries can cause a phantom limb pain where that pain is unresolved after surgery or trauma. Infantile colic, glaucoma. Someone brought up that question early on when we opened up the webinar. Glaucoma, dysmenorrhea. Dysmenorrhea is unbearable, painful menstrual cramps that you may know women that undergo that each and every month. Hyperemesis gravidarum. Those are those moms who have constant nausea and vomiting for the first trimester in pregnancy. Unexplained fetal wastage. You may know some women who have recurrent miscarriages. Post-traumatic stress disorder. Lots of folks have that, in bipolar disease. Now, these are just a few of the disease entities that Dr. Ethan Russo has already done the research and found data that shows that people who suffer from these things have a deficiency in their endocannabinoids, and they need cannabinoids that are coming from the cannabis plant to put the body back in balance. And this is a really important slide too. And these are things that you can do as far as foods to enhance your endocannabinoid system. Dark chocolate, essential fatty acids, making sure you're getting in your fish, your omega-3s, your omega-6, hemp seed oil, hemp oil, flax seeds, chia seeds, walnuts, sardines, anchovies, eggs, pasture-fed or omega-3 enriched only. So bottom line, eating healthy, eating well, incorporating some of these foods that enhance our endocannabinoid system. There's other things you can do to stimulate your endocannabinoid system. Exercise, yoga, meditation, prayer, carafilline. Those are terpenes. And we often talk about how our products are full spectrum and also contain terpenes. And of course, CBD, cannabidiol, which we're going to talk about this evening. So now you have a very, very fundamental understanding on the clinical endocannabinoid deficiency, some of the symptoms that you can have, as well as how it occurs, why it occurs, and the science behind it. So let's get into our product line. So our product line here at Wakanna is twofold. We have what we call a full spectrum line. Those are our power products. Those are the products in the black label. And then we have our pure products. Those are the broad spectrum products. Those are the products in the white label. And the great thing about the white label products are they can be taken by those who have clinical endocannabinoid deficiency, but may have random drug screens at their job. So they're able to use a product that contains less than 0.0% of THC. Now the power line has the legal limit of THC, which is 0.3% or less. The FDA does not approve any of these statements. We are not allowed to use words like treat, diagnose, or cure. If you're under your doctor's care, if you're on medications, especially multiple medications, if you're nursing or pregnant, please consult your physician before using our products. So a little bit about Wakanna. Wakanna is much more than a CBD company. I say this each and every month because it is. It's a movement. And our whole vision is that we exist to end the negative stigma. And why that's so important is because when you use the word cannabis, when you run into someone who, now that you know some of the symptoms of clinical endocannabinoid deficiency syndrome, and you use the word cannabis, most folks will run away from you, right? Because of the stigma, that negative stigma is still there. Well, now our whole goal here at Wakanna is to end that negative stigma by empowering and educating you about the part of the plant, the part of the cannabis plant that gives you the health without the high. And we're going to talk about that part of the plant. And then our mission, our also is to stir a movement, to be the catalyst, to help folks like you on this webinar that may be looking for your spot or your niche in this industry. You know, you may be looking to be an entrepreneur, a formulator, maybe just investing in the stock. So really helping to evoke the courage of people to confidently walk into the legal space of cannabis, to take back their health, their wealth, their legacy, and freedom. And quickly, I want you to meet the co-founders of Wakanna. Melissa Boston is the vision behind Wakanna. She's our CEO. She brings over 29 years of experience in direct sales. She also brings 15 years in corporate America. In fact, she fired her boss at the age of 33 years old. She's a social media strategist. She's an author. She's an entrepreneur of many years, but more importantly, she is the visionary behind Wakanna. And then our president, Dr. Patricia Van Pelt, is a state senator serving her third term here in Illinois. She's an entrepreneur, she's an author and evangelist. And Phyllis Nash, our fabulous Phyllis Nash, is our senior VP of sales. She brings over 30 years of experience, not only in real estate, the liquor industry, but the restaurant industry as well. So we are excited to have our three co-founders. And then myself, I'm Dr. Rita McGuire. I'm the Chief Medical Officer. I bring to you over 30 years of experience in obstetrics, gynecology. In fact, you know, every Wednesday I am here ready to deliver a baby, but thank God a baby never comes when I'm doing this presentation, but all four of us are experts. We're pioneers. We've been in this industry since 2017, and we are excited to be the leadership here at Wakanna. So let's look at the plant, okay? The plant cannabis we talked about has over 120 now plus compounds that have been identified, but let's concentrate now on the two species, right? This is really important. One species that the cannabis plant has is marijuana. That's a species that makes you high. That's a species that has that high level of THC that gives you the paranoia, the euphoria. And then there's the hemp species. That's a species we're going to talk about tonight, right? That's a species that does not get you high. It has very trace amounts of THC, 0.3% or less to be exact, and high levels of CBD. So we talk about that hemp species being the health without the high. And so again, CBD is an abbreviation for cannabidiol. I've been using CBD in my practice for the last 3 years, and yes, I use it with patients who are on traditional pharmaceutical medications. I use it with patients who are looking for a holistic, organic, more natural way to address their health. And again, unlike THC, CBD will not get you high. Now, what makes our product legal is the 2018 Farm Bill. See, in 2018, a bill was passed that now allows hemp to be a legal substance that comes from cannabis. See, for over 80 years, hemp was bundled in with marijuana. But now it is descheduled. No longer is it a Schedule I drug like LSD and heroin and cocaine, but hemp is now legal to cultivate, to consume, and to sell on a federal level in all 50 states. So that's what makes our product legal. So we also have other cannabinoids that we talk about when we talk about a full spectrum product. Not only is CBD has a multitude of medicinal benefits, but there are other compounds like CBG and CBN and Delta 8, which is now an up and coming cannabinoid we just found out. We had a meeting today, and Delta 8 is something we're going to be keeping our eyes on, but Delta 9 THC as well. But let's really concentrate on CBD and its medicinal benefits. You know, we talked about the clinical endocannabinoid system. We talked about certain disease entities that have already been researched, and data has now found that because our body doesn't produce enough endocannabinoids, we need CBD. And we need it when we're dealing with conditions that have inflammatory processes going on, like arthritis. CBD relieves pain. It's an analgesic or a pain reliever that's been used for over 5,000 years. It helps relieve psychosis and helps to stimulate the appetite. It reduces seizures and convulsions. So you can see some of the same medicinal benefits here with CBD that we have to ingest because our body doesn't make enough anandamide or 2-AG, and its medicinal uses when we take it in as a supplement byproduct. It also helps to suppress muscle spasm. It helps to manage blood sugar. It helps to treat acne, psoriasis, eczema. It inhibits cancer cell growth. It reduces the risk of arterial blockage. It increases bone growth. It kills or slows bacterial growth. So you can see now the correlation with the benefits that CBD gives us when we have a clinical endocannabinoid deficiency syndrome. And again, this is how CBD works. It's not a snake oil. It's not a magical potion. It's not a voodoo hoodoo. There is a real science behind how CBD and the other cannabinoids work in our body. We've already discussed it. It's through the endocannabinoid system. It's through these receptors that are looking for those neurotransmitters to send a signal to that knee and say, knee, CBD is on board, get back in balance, reduce the inflammation, reduce the pain. So you can see how it's just a big messenger system that is the most vital regulatory system in our body that every single person possesses that needs cannabinoids to put it back in balance. So let's talk about some of our products. This is one of my favorite parts of the presentation. Let's get into how these products can help those that you love, that you know, that maybe even you on the webinar can take advantage of. So our products are unique at Wakanna. In 2018, when the Farm Bill was passed, you best and believe there were CBD products and companies everywhere. People were making CBD products in their basement, in their garage. You can find CBD products at the gas station. I just laugh because there's a video store in Homewood where I live and they sell CBD. I'm like, who would buy CBD from a video store? So not all CBD is made equally. Our products are products you can trust. Why? Because we provide some of the most rich medicinal hemp that's fully compliant with the State Department of Agriculture regulations, meaning that our products, our hemp is grown organically. Our products are industrial hemp registered and our products are Farm Bill compliant. And that's really important, knowing that our products are coming from the hemp species and not the marijuana species. We also provide certificates of analysis on every single product that we sell here at Wakanna. What's a certificate of analysis? Well, it is a third-party validation. It's a lab that's unbiased that tests the potency and accuracy and safety of our products. And every single product that we have at Wakanna has a certificate of analysis. And it's critical during this time to have a certificate of analysis. So let's look at one of our products, and it's our Hempranium 500. It's probably one of our most popular products. Why? Because there's a proprietary formulation that makes this product unlike any other CBD product on the marketplace. We have a proprietary formulation where we have enhanced our CBD oil with certified organic essential oils, black seed, turmeric, and peppermint. Why did we do that? And why did we feel that it was very important to do that? Well, we understand that folks who have clinical endocannabinoid deficiency and may have a chronic condition that causes chronic pain, these essential oils actually help to enhance the anti-inflammatory properties that CBD already possesses. So this is a tincture. This is an oil that you're going to place underneath your tongue twice a day. And when you start with CBD, it's important to start it low and slow. Why low and slow? Well, because it's something that's new to the system. And we want to ensure here at Wakanna that slowly the CBD is introduced to the body so that you don't have any minor side effects. Those minor side effects can include a little drowsiness, a little fatigue, and a little nausea. So we want to make sure you start low and slow So 3 drops in the morning and 3 drops in the evening under the tongue, holding it for 60 seconds so that oil can be absorbed before you swallow. And then we have another product, which is a great product for those who suffer from clinical endocannabinoid deficiency. It's our topical Dr. Rita's Rub. It's our topical liquid relief. It's a great product that is 200 milligrams of CBD, along with 19 to 20 other USDA certified organic essential oils. Why did we have this proprietary formulation? Well, we understand that essential oils again enhance the anti-inflammatory properties of CBD. So applying this local CBD can give local relief to areas that cause inflammation, that cause pain, that cause swelling. Now, I use this particular product before I work out. And the reason why I pre-medicate before I work out is because I want to have an optimal workout. And you understand, if any of you are out there and you're working out and you can't really do that 10th burpee because that right knee starts to hurt, well, when you pre-medicate those areas, it causes the inflammation, it causes the discomfort to be minimal. So I love to pre-medicate before my workout, and I love to pre-medicate before I go to sleep. So I don't have any issues with that right knee, that left elbow, or that left shoulder and that lower back when I'm asleep at night. Love this topical product. And then our Diamond Pre-Roll is another very popular product. Why? Because it offers very fast relief. When you vape, when you smoke CBD, the onset of action is within 1 to 5 minutes. Now, the duration is only about an hour or two, meaning that once it gets into the system, it's short acting. That's why I like to combine the tincture, which is longer duration. I like to combine the tincture with the topical, with the pre-roll, because the onset of action is quick. So during those times where you need an acute fix, the pre-roll is a great way to do it. And what I love about the pre-roll is that you don't need a lot. 1, maybe 3 pulls on the pre-roll is all you need. So you don't need to smoke the entire CBD joint or pre-roll in one sitting. So I love having this on board. We also have cartridges that are just as effective and fast acting during those acute conditions. Now, let me warn you about these power gummies. All of you that are business partners know that we were out of stock for a long time with these power gummies. These gummies are infused. They are not coated. What does infused mean? Infused means that these gummies, you probably only need a half. Take it from Dr. Rita, who ate more than half a gummy. You don't need a lot. Each gummy is 25 milligrams of CBD. Again, whenever you see that black label, that means that's a product that contains the legal limit of THC. So if you undergo random drug screens, you want to stay with all of our products that have the white labels, or all of our products that are topicals. Because see, topical products like our topical pain cream, our topical liquid relief, our empowered hair that you can put for hair growth topically, does not pass the blood-brain barrier, which means it does not pass in your urine. But all of the other products that you're ingesting, you're eating, you're swallowing with a black label, if you have random drug screens, please use our white label products. So these gummies are amazing. They are a little bit more potent, so watch out. I would start with half a gummy. I love using the gummy at night. Gummies help you sleep. We talked about Clinical Endocannabinoid Deficiency. What was at the top of the list? People who have issues with insomnia and are now looking for medications to help them sleep. So the Power Gummy is something you want to take to help you sleep at night. How does that work? Well, that neurotransmitter in the brain locks arms with that receptor and releases some of the chemicals that the brain is deficient in that causes insomnia. So the science behind this clinical endocannabinoid system, clinical endocannabinoid deficiency syndrome, is amazing. So we have a 20 count bottle. We also have a 4 count package, a great way to get sleep, a great way to address inflammation, and many tell us who have libido issues, a great way to improve your libido. And then our newest broad spectrum gummies, again, this is a gummy. If you have random drug screens, you can use and still pass your urine drug screen. So these new gummies, as you know, are 25 milligrams. You will have a 20 count bottle now, and it's a great way to use before you go to sleep. What I failed to mention was that gummies take about 30 to 90 minutes to kick in, right? This is the reason why I like to combine tinctures with the topicals, with the fast-acting pre-roll, with the gummy. Because synergistically, as one is kicking in, the other one's duration is wearing off. So while you're sleeping, this gummy is addressing those issues with inflammation, those issues with pain, and to help you get into that rapid eye movement sleep or that REM sleep. So these new gummies are 25 milligrams. The new gummies is a 20 count bottle. I did not change the slide. We also have a 5-pack count of our new broad spectrum gummies. So you want to order those immediately. Our CBD sexual lube, again, part of the clinical endocannabinoid deficiency, a decrease in libido, a decrease in vaginal lubrication, erectile dysfunction. This is a lube that you're going to use topically for those issues. 400 milligrams of CBD. It's a water base, so it's compatible with condoms. Again, it enhances the sensation during intercourse. And then our Power Mango Body Cream, another product that we can't keep on the shelf. Why? Because we understand that those who have conditions like lupus, fibromyalgia, a lot of the autoimmune diseases have skin rashes that accompany those issues. So this is a great product. Again, 500 milligrams of CBD that helps to restore the balance of our skin. So you can see that the cannabinoid deficiency can be improved with CBD products. We talked about how that works in the endocannabinoid system, how those receptors are looking for CBD, they're looking for THC to put the body back in balance. We also know that we can enhance our endocannabinoid system, right? We can enhance it with different foods like chocolate and hemp seeds and hemp oil and plant-based fresh fruits and vegetables. We also know that there are other activities that we can do, like yoga, meditation, and exercising and working out. And all of these things combined with CBD makes it magical. All of those things then make it magical. So I'm going to stop. I'm going to take questions. Hopefully you have a lot of questions, and hopefully you've put them in the chat box. But I do want to remind you that tomorrow night, if you want more information about our business, maybe you hear some information tonight and you want to get more deep into how do I become a part of a business opportunity and lock arms with us here at Wakanna, you want to tune in tomorrow evening at 8 p.m. with Minister Mooney as he does a business overview. So let's take some questions. You're going to put those questions in the chat box for me, and we are going to answer some of these questions. So let's see here. We have, what advice do you have for someone who has taken the broad spectrum gummy to assist with sleep and did not get any results? Well, this is the thing about CBD. Some people need more CBD than others. So if that person was taking our broad spectrum gummy that was 40 milligrams of CBD, they absolutely can take 2 broad spectrum gummies at night. They can also combine those gummies with tincture. I always tell people that the majority of folks are going to need more than just a gummy. We're dealing with clinical endocannabinoid deficiency. We're dealing with people that have very low levels of endogenous cannabinoids that our body should be making. So you need to pair it with the tincture, 2 drops or 3 drops twice a day, along with the gummy at night, along with a fast-acting product like a pre-roll or a cartridge, along with diet and exercise, and that's what makes it magical, okay? So pair it with all of our other products. So one gummy is probably not going to address someone who has a clinical endocannabinoid deficiency. Which products are recommended for COVID? Well, there is no treatment or medication yet for COVID, but we do have amazing essential oils that help to boost our immune system, because I always say each and every week, we cannot control the virus, but we can control our host. So by building up your immune system, how do you do that? You got to get enough sleep. You've got to eat well. You've got to get enough water. You've got to supplement your endocannabinoid system with good food, with CBD, and we have a whole defense package of essential oils, black seed, tea tree, eucalyptus, and peppermint. We have an essential defense, which is a formulation of 5 essential oils that are together. We have a first essential defense, which is a nasal CBD and essential oils. So whoever invited you on the line can get you more information, but we can never, ever say that we have products to cure, to treat, or to diagnose. We cannot use those words, especially when it comes to COVID-19, especially when it comes to a novel virus that we don't have any treatment for currently. Is the mango body cream safe to be used on the face? Absolutely, yes. I use the mango body cream on my face. I would test it. Whenever you're using a topical product, always use a test area. So use a small area on your face here, because my face is different from your face, which is different from her face and his face. We have some sensitivities, so make sure you use a small area to do a patch test first, but I personally use the mango body cream all over my body. What regimen should someone start on who has suffered from a stroke? Well, someone who has suffered from a stroke, our products are really great to improve their overall symptoms from stroke recovery patients. So the CBD tinctures, along with the topicals, along with the gummies at night, the whole package will help those who are now recovering from stroke. We had a whole presentation last week on stroke, so you can absolutely, Mary, get that recording so you can see other recommendations and regimens that we talked about last week. Any other questions? Man, we had a great group. We had over 85, almost 90 people on the call tonight. So whoever invited you on the call, you want to get back with that person. You want to thank them first, because I'm telling you, this entire month is going to be amazing information. And we're going to have Dr. Ethan Russo. I'm going to have him on my webinar. He's going to be on July the 29th. He discovered the clinical endocannabinoid system, clinical endocannabinoid syndrome deficiency. I spoke on stage with him in Portland, Oregon. I know him well, so he is going to grace us with his presence. But before then, we're going to be talking each and every week about different disease entities that combine the clinical endocannabinoid deficiency. We're going to be talking about fibromyalgia. We're going to be talking about glaucoma. We're going to be talking about irritable bowel syndrome. We're going to be talking about all of the disease entities that surround the clinical endocannabinoid deficiency. We all are deficient. We all need cannabinoids. That's why we all need CBD. Okay? So with that being said, I'm going to close it out. Oh, there's another question. What regimen would someone with irritable bowel syndrome try? The same regimen as I always recommend. The Hempranium 500 tincture, 3 drops twice a day. Also the Power or the Pure gummies, along with a fast-acting regimen for those acute issues of irritable bowel syndrome. They have a lot of abdominal pain, some waxing and waning of constipation and diarrhea. So combining all of the products is a great regimen for those who have irritable bowel syndrome, clinical endocannabinoid deficiency syndrome, et cetera, et cetera. So great, great questions. I'm going to see if there's any more questions in the chat that I missed that were early on. We've got the broad spectrum. Any other questions? Acid reflux and inflammation, same thing. Acid reflux and inflammation is part of the clinical endocannabinoid syndrome deficiency. Making sure that you are reducing inflammation in the body. Using the tincture, Hempranium 500, 3 drops in the morning, 3 drops in the evening. Combining that with the tincture at night, combining that with that pre-roll or cartridge for those acute flares. Diet, I can't stress enough how important diet is in an acid reflux. Taking fried food out of your diet, taking processed food out of your diet, getting a diet that is plant-based, lots of fruits, lots of vegetables. You know, I eat really, really healthy. Making sure that when you combine all of those things with CBD, you have much, much better results. So great, great question. A lot of people suffer from acid reflux. It's inflammation. You get that inflammation under control in the body, and you have improved those symptoms. Great question. Any other questions? Let's see, I have some questions. Suggestion for glaucoma. So glaucoma is a great example, because glaucoma was one of the very first illnesses that was tested in the 60s as it relates to cannabis by a gentleman by the name of Robert Randall. Actually sued the government because cannabis was the only treatment that improved his glaucoma, right? Now with CBD, so many studies have been done. It's just important that you understand that with glaucoma, because it's an increase in pressure in the eye, and because it's inflammation of the optic nerve, you should not consume more than 40 milligrams of CBD a day if you have glaucoma. You should not consume more than 40 milligrams of CBD if you have glaucoma. Okay, so you want to make sure that if you have glaucoma and you've got one gummy at night, that's already 25 milligrams, right? So you only have a little wiggle room there. So 3 drops of the Hempranium 500 in the morning and 3 drops of the Hempranium 500 milligrams in the evening is a great combination that will keep you under 40 milligrams of CBD. Real important. Studies have already shown, don't go over 40. I had one more question in the chat area, no, in the Q&A area. Let me get that question. What are your thoughts on spinal stenosis with CBD? Well, any stenosis, any inflammation, any pain, you want to make sure that you use the topical products in combination with the tincture. Now, what's really interesting is that I've run into a couple of distributors, business partners that have combined our Dr. Rita's rub with our topical cream, right? Pretty interesting. I've not had to do that. I have lower back issues just from working out so much. So the Dr. Rita's rub, in my opinion, is one of our most potent topicals because not only does it have the CBD, but it also has 19 to 20 essential oils. So you're combining the anti-inflammatory properties of the essential oils with the CBD, and together it is really effective. You know, folks who have spinal stenosis, you know, that calls for Hempranium MD. Hempranium MD is our more potent tincture. I like using Hempranium MD when you're using and talking about folks who have more severe, long-standing conditions that include inflammation and pain. So with spinal stenosis, I would recommend our Hempranium MD, along with that Dr. Rita's rub, along with that pre-roll or cartridge with one gummy at night. So that's a really great combination to combine all products, starting low and starting slow, even with the Hempranium MD, 3 drops in the morning, 3 drops in the evening. The Hempranium MD is 2.5 milligrams per drop. The Hempranium 500 is 1.67 milligrams per drop. So if you're a guest on the line, don't get overwhelmed with all this information that I've given. The person that invited you absolutely has the knowledge because I've drilled it into them each and every week, and on our certification, they can absolutely help you with dosing. There's another question in the chat box. You've been using the relief cream on the pain and I get from sunburn rashes due to allergies. Deborah, if you could reword that question because I don't understand it. It's a lot going on in that question. Just reword it for me and put it in the chat. Fibroids, oh gosh, fibroids cause a lot of pain, cause a lot of discomfort, cause a lot of bleeding. A good regimen would be to really recommend the topical to help to rub on the area where the fibroid is to help reduce that pain, and the tinctures as well twice a day. Deborah Blackman, if you could re-type that out, or you can send me an email to ritamd@wakanna.com because I don't understand your question. Oh, it's a statement. I'm sorry. It's been a long day. It's a statement. The statement. You were letting me know how you use it. Oh, thank you. Okay, it's a statement that she uses the Power Mango Cream on rashes due to sunburn and to allergies. Very good. So great to hear that testimony. Wonderful. So we want to say goodnight. It's been a great conversation. You don't want to miss any of my series for July. You don't want to miss it. You definitely don't want to miss Dr. Ethan Russo who's going to be on at the end of July. But you want to make sure that you get back to the person who invited you so that you can get those products ordered. You want to make sure that you invite your guests to our Wakanna Facebook page. So have an amazing night. Love each and every one of you. We will see you next time. Good night.